Hello, everyone. I'm going to wait just a minute before I get started today, just to let some people in the chat. But how's everyone doing today? I hope everyone had a really nice Labor Day weekend. I know that I did. I spent some time with family, kind of out of the DMV area, which was nice for a change. It was a little cooler where I went in New York State. How's it going? Hope everyone had a good Labor Day. I'm just going to wait one more minute before diving in to let some people join who might be interested in hearing about our topic today. We're talking about COVID-19, talking about what it's like to actually have COVID. So just waiting a second. If anyone wants to put their Labor Day adventures in the chat, they can do that. I'm going to just pin a comment real quick so that you guys know how you can get free HIV and STI testing. I'll say the number that I'm about to post. Number is 202-797-4439. And I'm pinning that comment right there. Okay, so I think I'm going to get started. Whitman-Walker's Community Health Department has been expanding its community outreach to the social media realm. And we cover a lot of topics on this platform. We talk about HIV and STIs, sexual health practices, access to care, social determinants of health, and other general public health interventions. And so today we're going to be focusing on the COVID-19 pandemic. Community health team is here to support you, give you information. So please feel free to reach out to us, call that number down there, DM us. We are here for you. If you don't know who I am, my name is Brendan. My pronouns are he, him. I'm a community health worker with Whitman-Walker. I've been here for a little over a year. I absolutely love working here, doing this kind of outreach with you guys. So today I'm going to be speaking through the lens of a community health worker, just kind of talking from my personal experience in the field during the COVID-19 pandemic. On previous lives, we've talked a lot about COVID-19 prevention. So that includes, social distancing, wearing your mask, getting vaccinated. I see someone in the comments said that they just got their first dose of the vaccine today. Goldstein Bianca, congratulations. That's wonderful. You join about 200 million Americans who have also received their first dose of the COVID vaccine. We don't often talk about what COVID-19 looks like as an illness. 40 million people in the U.S. have tested positive for COVID-19, and little over 650,000 people have died of COVID-19 in America. So a lot of people in the United States are intimately familiar with COVID-19 and its life-changing consequences. But it's a really big country. 40 million people have tested positive out of 350 million. So that means a lot of people might not have that personal experience, including myself. I've seen a lot of what COVID-19 is like as a community health worker, but I've never had it. And I think it's really important to kind of remind ourselves what actually happens when you get COVID. I think a lot of times we talk about prevention, but I hope that by shining a light on what it actually is like to get COVID as a disease, as an illness, we can encourage people to get vaccinated and end the terrible surge that we are in right now. So brings us to our main question today. What is it like to have COVID-19? There is no one answer to that question. I feel like a lot of times when people get the flu, they have very similar experiences. It's influenza, has some pretty classic symptoms. COVID is a strange disease. For some people, COVID is not bad at all. An analysis by a group of U.S. medical researchers on more than over 350 studies has found that somewhere between 20 to 35% of people who get COVID-19 infections do not show any symptoms. They do not proceed to a symptomatic phase, which is really curious. So if you get infected with COVID-19, it doesn't necessarily mean that you'll get sick. On the flip side, though, That means that 65 to 80% of COVID infections do proceed to a symptomatic phase, making your chances of feeling under the weather definitely more than likely. So I know some people talk about asymptomatic infections, but I want to reiterate that the majority of people who get COVID-19 do experience symptoms. And also that 65 to 80% that I'm talking about, I'm just talking about the acute phase. So that is like right when you get COVID, that fever chills that you might feel. It does not include those kind of potential long-term effects of COVID-19 that might not be present right when you get affected. And we are still learning about those. COVID-19, it's called 19 because it showed up right at the end of 2019. It's a very new disease compared to compared to so many diseases that showed up in the 1500s. We have hundreds of years of research on. Medical research have so far identified 55 long-term effects of COVID-19. And most of those effects, while they follow symptomatic infection, do not have to. So that includes impaired heart functioning, kind of long-term COVID-19 symptoms. Those do not follow the traditional acute respiratory illness. And, you are still at risk of getting those, even if for anyone who gets the COVID-19 infection. So let's say that someone does show symptoms of COVID-19 right after they get infected, because that's most likely. Symptoms will generally appear 2 to 14 days after exposure to the virus. They often include things like fever, chills, cough, shortness of breath, fatigue, muscle and body aches, headache, interestingly, loss of taste and smell, sore throat, congestion, runny nose, nausea, vomiting, all that sorts of stuff. Other than the loss of taste and smell, these symptoms mirror a number of other infections, most of which are less severe than COVID. So that's why it's really important that you go get tested when you experience any of those symptoms. Hopefully you are only experiencing just like a mild respiratory infection, but if you think that you might have COVID, it's really important you go get tested so that you can take control of your health. In DC, you can get tested really easily. You can get tested at home. Just call 202-602-0814, and you can order a test kit that will get delivered right to your home. If you don't want to use the DC government, you can also order an at-home Pixel by LabCorp kit, also delivered to your door. You can go to a local Safeway or CVS convenience store to either pick up a test kit or to get tested yourself there. And there are just many testing sites throughout DC, Maryland, Virginia, including Whitman-Walker. Lots of ways to get tested. I recommend a quick Google search, or you can just rewind on the live that I'm doing now to figure out how you can get tested super easily. Most people with COVID-19 infection will only have mild symptoms and will get better on their own, which is really, really good. But 1 in 6 people who get infected with COVID-19 experience more severe symptoms. And those can include difficulty breathing, chest pain, and around 5 to 10% of people infected need critical medical support. And that includes hospitalization. So in the end, 1 to 3% of people infected with COVID-19 end up dying. That's a really high statistic. You're right. You might be thinking some people are more at risk of those really bad outcomes than others. Most notably, older people have significantly worse outcomes, as do people with compromised immune systems and people with underlying medical conditions that might hurt their immune system. So like HIV or diabetes. But even if you're not more at risk for these severe symptoms of COVID-19, the chances of you experiencing severe illness are still very high compared to other diseases. So for example, in the average flu season, we'll only have a death rate of maybe 0.1%, which if you compare that to COVID, which is anywhere from 1 to 3%, that's significantly higher, something like over 10 times worse. So if after this you're not still concerned about COVID-19, I will walk you through what it's like right now if you have to go to the hospital for your symptoms. And remember, 1 in 6 people do need that kind of critical medical support. So it is not out of the realm of possibility. If you have to go to the hospital because of the severity of your COVID-19 infection, So that could mean that you just have really difficulty breathing, or you have a high fever. There is some symptom that you cannot control yourself and you need life-saving support. You'll have to get triaged like all the other patients at the emergency department. And unfortunately, COVID-19 has gotten so bad that in some parts of this country, beds are not available, even in ICUs. So it might take a very long time for a doctor to come see you. Obviously, you're going to receive the best medical care possible, but doctors have been fighting COVID-19 nonstop since March, and a lot of them are very burned out. They're going to provide the best care for you as possible. And over the past few months, new breakthroughs in medicine and biotechnology have made it better to get you COVID-19 treatments. You might have heard of monoclonal antibodies. There's a medication called dexamethasone that's being recommended now. Other medications are there as well. But I want to emphasize that there is no cure for COVID-19. If these treatments do not work on you, we still have very few clinical tools to fight COVID-19. And especially with an overwhelmed healthcare system, burnt out doctors, and a highly unvaccinated population, you may have to be intubated, put on a ventilator, which is a machine that breathes for you when your lungs stop working. And you might not be able to receive the same kind of care that you would be able to receive if we didn't have this kind of surge where hospitals were at their full capacity, where doctors were pushed to their limits. So this is kind of all to say you do not want to get COVID-19. There is no way to know whether you'll be an asymptomatic patient, like I talked about at the beginning of this live, or whether you'll be one of the ones with severe symptoms, or even whether you'll be what's called a long-haul COVID patient. So someone who has COVID symptoms that can last months or years. It's best not to take the gamble because you do not know which you will be. So you want to protect yourself and you want to protect your loved ones and your community as best as you can. And the best way to do that is to get vaccinated. It's become highly polarized in our country, but I really want to recommend vaccination because it is the single best way that you can make sure you will not, you are preventing against any of these severe symptoms. So if you've already gotten vaccinated, congratulations. You have taken a very important step to preventing yourself, your loved ones, and your communities from illness. And the Delta variant, as I said, is soaring across the United States. So it is totally understandable why, in addition to the vaccine, you might want to continue other protocols like social distancing and mask wearing. I will point out that the vaccine is probably the best tool in our tool belt to fight the virus. It is not 100% effective. There are breakthrough infections. And there are very few protocols to make sure that the people around you are also vaccinated. So keep staying on alert and keep following CDC guidelines and keeping yourself safe. If you haven't been vaccinated against COVID-19 yet and you're looking for an appointment, you can find them so many different places across the DMV area. So Whitman-Walker Health has COVID-19 vaccine appointments available. Everyone ages 12 and up are able to receive the Pfizer vaccine, and everyone ages 16 and up are able to receive any of the vaccines. So that includes Moderna and Johnson & Johnson as well. If you want to get vaccinated at Whitman-Walker Health, or if you want to ask any questions about where you can get vaccinated, please reach out 202-207-2480 to make an appointment. And if you're having trouble making an appointment with us, DC residents, you can find information on walk-up locations and eligibility by going to vaccinate.dc.gov or by calling the number 1-855-363-0333. If you're a Maryland resident, you can learn more by going to covidlink.maryland.gov or by calling 855-634-6829. And if you're a Virginia resident, you can learn more by going to vaccinate.virginia.gov or by calling 877-829-4682. So threw a lot of numbers and web addresses at you. If you need to go back, we're going to post this live so you can go rewind, figure out what websites you need to go to, what phone numbers you need to call, depending upon where you live. If you haven't been vaccinated and you're still not looking for an appointment, please consider the decision that you are making. The vaccine has no documented long-term side effects. It has received FDA approval, and it's been administered to over 200 million Americans without a hitch. For your safety and for the safety of your community, please look at a vaccine site. And if you don't, please continue to follow the CDC guidelines for mask wearing, for quarantining, for social distancing, and the like. Does anyone have any questions? I am here to answer them as a community health worker with my experience, helping people get the vaccine and working with people who might need COVID treatment. So I'm just going to wait a few minutes to see if anyone has any questions in the comments. I hope that everyone who's watching this either has been vaccinated or is thinking about getting the vaccine, because I just want to reiterate, you do not want to get COVID. You do not know what's going to happen if you get infected. Could be asymptomatic, or it could be a visit to the hospital. And thank you for all this support in the chat. It sounds great that, people are getting vaccinated. People are encouraging their friends and families to get vaccinated, supporting the call for as high immunization rates as possible. If there are no questions, I just want to finish by saying thank you so much for tuning in. It was great to talk to you guys today. I actually do see one question. Is the booster shot the same as the first 2 shots? That's a good question. And I actually can't provide a lot of information on that now because it's a rapidly developing situation. So right now, the FDA has approved what you can call a booster shot. I don't think the FDA is technically calling it a booster shot. They're just calling it an additional dose. And it's specifically for people who are immunocompromised, who might have a certain medical condition or be on a certain treatment that impairs their immune system. And so people are definitely receiving that 3rd dose right now. It is not widespread for people to get a 3rd dose. So what I would recommend is calling your doctor, getting in touch with your primary care provider, or calling Whitman-Walker to figure out if you're eligible for that 3rd dose. In addition to that 3rd dose, I think the CDC, FDA, White House, they're all debating right now whether more Americans should get a traditional booster shot. So they're debating whether after 8 months, people should get another booster to keep their immunity up. And there are no guidelines out for that right now. So I'm not going to be able to speak on whether the booster shot's the same as the first 2 shots. I imagine it would be a very similar thing where, if you got Pfizer, you'd go into a medical provider, they'd give you a 3rd shot. But again, it's not been approved. We're still waiting to hear more data about it. So I hope that we can do an Instagram live about it pretty soon. But just waiting for Dr. Fauci, the medical teams out there to kind of figure out what we're going to do with boosters. I see a comment. My friend has COVID. She was scared of getting vaccinated and has been having really bad vertigo. Any info on that among COVID patients so far? So I think I mentioned at the beginning of this live that COVID is a really weird disease. I think with a lot of diseases, like let's say the flu, there's a pretty set, there are very traditional symptoms of the flu or of another common respiratory infection. But COVID can present in a number of different ways. Some people don't have any symptoms at all. Some people have traditional flu-like symptoms. Some people would kind of just lose their sense of smell and taste. And then I think you're right. It's like your friend. They might be experiencing something totally different, like vertigo. Not everyone who gets COVID reports experiencing vertigo. I'm not sure the percentile specifically, but I do know that it's a possible symptom. So if the vertigo, again, gets really bad, or if any symptom gets bad enough that they cannot take care of themselves on their own, I would recommend seeking medical treatment. So whether that's going to an urgent care or to a hospital, depending upon the level of urgency. But But yes, I do want to affirm that that definitely is a symptom that can happen. And it's not talked about a lot, but that's just because there's such heterogeneity in the presentation of COVID. It looks different for everyone, and you don't know how it's going to look for you. I also want to point out that you said your friend has COVID. She was scared of getting the vaccine. So most people that are getting COVID these days, which actually is a lot of people if you look at the statistics, are not vaccinated. The vast majority of people getting COVID aren't vaccinated. Even higher than that are the people who are in the hospital and the people who are experiencing the most severe symptoms. All of them are unvaccinated. And this speaks to the power of the vaccine, the power of immunization at improving our health. So again, I'm just going to put a plug in there. You might be scared of getting the vaccine. I want to urge you that what's scarier than getting vaccinated is getting COVID. And if you're not vaccinated, you are leaving yourself very vulnerable. If you get the vaccine, I've never heard of someone who's gotten the vaccine and had extreme vertigo, but I have heard someone get COVID and have that kind of symptom. I see another person who says, I'm fully vaccinated, wear a mask. I still contracted the new variant. Even though I'm immune compromised, thanks to the vaccine, I recovered in 14 plus days. So yeah, congratulations on taking care of your health and then getting better, even when this deadly Delta variant is causing breakthrough infections. So it's really remarkable, especially for someone who's immune compromised. That must have been a really difficult experience. And it speaks to how, the vaccine, it's not 100% effective, but also I'm sure you must have considered what might have happened if you hadn't gotten vaccinated. Recovering in 14 plus days, that's a long time to be sick. I don't even want to speculate what could have happened if you were not vaccinated. It's so important that we equip our bodies with whatever tools possible. Wearing a mask, getting the vaccine, social distancing, because this Delta variant is very deadly. It's very serious. And, the vaccine is a powerful tool. It's not perfect, but I'm glad to hear that you are feeling better. Any other questions, comments, or concerns? All right. Well, you might be typing away. I'm just going to say one last little thing. If you want to support Whitman-Walker Health, I encourage you to register to walk, run, and or donate to this year's virtual walk and 5K to end HIV. It's taking place on Saturday, October 23rd. And this year marks a very special year. It's the 35th anniversary of the walk. So register yourself or a team today at walktoendhiv.org. This is our biggest fundraiser. It's really exciting. Unfortunately, it's going to be mostly virtual this year, but we can still get that same sense of community and you can still support Whitman-Walker. So no filter DC, just put it in the chat down there. walktoendhiv.org. We would really appreciate if you were able to get on that website and walk, run, donate. Anything would help. Also want to say, remember to follow us on Instagram, Facebook, Twitter. The handle is @Whitman-Walker. Also check out our website, www.whitmanwalker.org, for the most up-to-date information on our services and for more COVID-19 resources and all that jazz. I pinned the number below if you want HIV STI testing. If you call that number, I answer it most days. So do my colleagues. We can transfer you to anyone you want. So pretty much any question you have, you can just look at that number, 202-797-4439. Thanks so much for tuning in today. It was really great to talk to y'all. Best of luck. Stay safe out there. Protect yourselves, protect your families, your communities. And let us know what we can do to help. We are here for you. All right. Bye, everyone. Thanks so much.